So here's the state of American healthcare today. I'm a cardiologist, and a patient was referred to me for a cardiology procedure because, well, they need the procedure. Now, before we can schedule it, we have to get approval from the insurance company, which often requires a prior authorization. So for that, we submit all the information to the insurance company and await their decision whether it's approved. Of course, as it frequently happens, it was not approved, and they're requesting more information. So we submit more data. Several days later, they come back and say, nope, still not approved. So they're requiring a peer-to-peer, which means that I get on a phone call with a doctor who's employed by the insurance company. So then we have to schedule the peer-to-peer. So my staff gets on the phone, day 1, day 2, day 3, an hour plus on hold each time until they finally get through. And then they schedule a phone call, which is scheduled at the end of the week. They give you the time, and I got to carve out time in my schedule in the middle of the day so I can speak to this doctor. Mind you, this process is now taking almost 2 weeks. And at the end of the day, it's probably still going to be denied.
So the other week, the CEO of United Healthcare doubled down and insisted that healthcare insurance companies were protecting patients against unnecessary medical procedures. Basically saying that doctors are doing unnecessary things, and that's why insurance companies don't pay for it. Here's the thing. Who defines what's necessary? Because what might be necessary to make a diagnosis or to save a life may not be so necessary when you're talking about costs and profit, because maybe that treatment or that test costs a little bit more than other ones. You see the problem here? Most doctors are paid by salary. So we get paid whether or not we do the test or not, prescribe the medication or not. For some doctors, I get paid the same whether I do the surgery or not. So what incentive do I have to do anything unnecessary? But I get it. If you are an insurance company trying to protect your multi-billion-dollar profit, hiding behind your desks and all the layers of bureaucracy, blame the doctors who the patients actually see and more easily get mad at.
So I just moved to Barcelona from the States, and let me just say, our healthcare in the States is fucking ridiculous. I'm epileptic, so I have to take medicine every single day. If I don't, I will have seizures. And back home, I pay a shit ton for healthcare, and on top of that, I still have to pay some for my medicine. Now, even though I've had epilepsy since I was 14, it's happened where my prescription expires, I guess, and I can't get more medicine until I see the doctor. But then to make an appointment with the doctor, it takes a whole month and a half, 2 months to even get an appointment. So long story short, I used to have to buy my medicine in Colombia. Every time I went to Colombia, I would stock up, whatever. So once I got here, I was like, shit, I need to see a doctor so I can get a new prescription. I don't have enough medicine, whatever. Mind you, I had to pay $400 because I'm a foreigner, but that $400 is for the entire year, and I have no deductibles. Everything is fucking included. It's insane. So I call my insurance, and I'm like, hey, I need to see a neurologist, blah, 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 whatever. She goes, oh, do you need an appointment for today? I was like, yeah, sure. Gave me an appointment within 40 minutes. It literally took me not even 5 minutes with the doctor. He asked me, what type of epilepsy do you have, blah, blah, blah. Do you have a picture of your medicine, blah, blah. Gave me the prescription just like that. I went to pick it up. It was free. Like, why can't we do that? We're supposed to be the richest country in the fucking world, and we can't do that. And it has to be, I have to buy my medicine from a foreign fucking country. Like, come on. Do better. Like,
having our access to healthcare be largely dependent on our employment status in the US was done on purpose. It puts us at the mercy of our employers. It makes it much harder to fight for better wages, better working conditions, better benefits, because we have more to lose. Not only is our job at risk, but so is our access to healthcare. It makes us more willing to accept scraps from employers because at least with a job, when you're sick, you're able to go to the doctor and not have to pay hundreds of dollars for the visit. It also de-incentivizes people from starting their own business and being self-employed because it's usually a lot cheaper and easier to just get health insurance through your employer than it is to try to get it on your own individually. And I feel like having health insurance gives us the illusion of having access to healthcare. Obviously, with health insurance, your access to healthcare is a lot greater than somebody who doesn't have health insurance. But even with health insurance, you can be denied medically necessary procedures. That's the whole business model of the private health insurance industry. It's how they make their money. Collect as much money from their customers as possible and deny them as much health care that they paid for as possible.
Now I knew healthcare in America was a joke, but I truly had no idea what I was really in for when I turned 26. If you're unaware, in America, when you turn 26 years old, you can no longer be on your parents' medical insurance. And because my birthday is next month, I have to now set up my own. And oh my fucking God, I'm going to throw up. Obviously, my first choice was to stay with my provider, right? Because I've had them my whole fucking life. And because I would be signing up for insurance as an individual rather than through an employer, this was the cheapest plan they could offer me. $285 per month with a $6,000 deductible and $60 co-pays every time I go to the doctor. Ooh, let's not forget the $90 if I get sick and need a prescription. So let's do some math. I'm a pretty healthy girl. I only go to the doctor maybe once a year. So $285 a month for 12 months, that's $3,420, plus the $6,000 deductible, which is $9,420, plus the $60 for my doctor's visit, plus the $90 in case I need a prescription. That's another $150, bringing our grand total to $9,570. That's $9,570 out of my pocket before insurance even covers anything. And to me, these are exorbitant numbers. But then I post that shit on Twitter and people are like up my ass telling me that that is cheap. So I'm even saying I shouldn't be complaining. Forgive me for believing that any amount of money for care that I need to sustain my life is too damn much. And of course, I'm neurospicy, okay? Once I get into something, it's like a rabbit hole that I cannot stop. So I start doing further research. Is it even really worth it? Like, if something does happen, how much is it going to cost and how much is insurance going to cover? So I'm like, okay, what is the average cost of one night in a hospital? The average cost per day in a hospital in the US is $2,883. But I live in California. So that's looking more like $4,181. So then I tried to research how much of that actually gets covered by insurance, only to find out that insurance companies, people without medical degrees, can decide you don't need the treatment that your doctor is saying you need to live. And then they just won't cover it. They just won't cover it. This is what the grown-ups be doing? This is your fucking life? This is gonna be my life? How is this sustainable? I'm sorry, I am truly baffled. What's most shocking is this is normalized in America. Like, there were people on Twitter trying to convince me that this was normal. This isn't fucking normal, guys. It's not fucking normal.
Hey everyone, welcome back to my channel, where we take a closer look at big topics, break them down, and try to make sense of it all. Today, we are diving into a phrase you have probably heard before. The US healthcare system is a joke. It's a bold statement, right? But it's one that comes up a lot, whether you are scrolling through social media, watching late night TV, or talking to friends. So why do people say this? Is it just exaggeration, or is there something deeper going on? Let's break down the reasons why so many people feel this way, starting with the high cost, then moving on to access inefficiency and the profit-driven nature of the system. Buckle up, because this one is going to be a wild ride.
Just got back from the doctor and I'm so fucking fed up with this healthcare system. Like, forget about the fact that I've had chronic pain for 8 fucking years, and I've been on a track to figure out what the issue is, and it was a track, and then the track just got derailed like 2 months ago onto a new track. The problem is, every fucking time I go to the doctor, I have to explain everything from scratch. Everything. For 8 fucking years, I've been explaining everything from scratch. And over the course of 18 years, more has been added to the scratch. And then they send you here, and they send you there, and they send you back there, and then nobody's communicating. And I provide all of the past medical history. Does anybody look at it? No! Why the fuck would they look at it? I got to the fucking doctor today for a follow-up from a referral she made to a specialist, and then he sent me back to her to refer me to another specialist. And what does she say to me? The nurse practitioner, not even the doctor, because you never even get to see the doctor that's on the name of the building or on the paper, ever. She asks, what brings you in here today? I'm sorry, ma'am. What? Like, literally, are you joking? They're typing all this shit in this chart all the time. Why don't they read the chart? Why don't they ever read the chart? You sent me somewhere. I'm back. What? And then they want to treat me like a junkie because I've got chronic pain. And I'm like, I'm not even asking for pills. She's like, well, then what do you want? I'm like, I want you to figure out what the fuck is wrong with me. I'm so over it. I'm so fucking tired of explaining myself to doctors and nurses, and what's the fucking point? They don't believe you, or they don't remember you. You got to start over. They send you somewhere else. I can't remember the last time that I went to the doctor that I didn't get back to the car and immediately break down crying. I can't remember the last time I went to the fucking doctor and didn't almost break down crying during the appointment, including today. Almost scream, almost start literally breaking shit because I'm so frustrated. But it's all good because we just ran some more blood tests that she's gonna fucking forget what the fuck they were for or why she made me do them next time I talk to her. Great!
Let's talk about something that comes up all the time in discussions about healthcare. Why so many people say the US healthcare system is a joke. Now, of course, this isn't a statement people make lightly. After all, healthcare is a serious life or death issue. But when we look at the cost, the inefficiency, the lack of universal access, and the profit-driven nature of the system, it's easy to see why so many feel this way. In this commentary, I want to explore the core issue that make the US healthcare system so frustrating, controversial, and frankly laughable to many people. Not because it's funny, but because the situation is so absurd it feels almost surreal. So let's dive in. Let's start with what is arguably the biggest issue, the sheer cost of healthcare in United States. The US spends more on healthcare than any other country, around $4.3 trillion a year. That is more than $12,000 per person per year, and yet for all this spending, the results are shockingly medical. Take life expectancies, for example. The US ranks lower than many developed countries, despite spending nearly double what they do per person. And infant mortality rates, they are higher here than in most other wealthy nations. So where are all this money going? A big part of it is administrative costs. The US healthcare system is incredibly complex, with layers upon layers of paperwork, billing codes, and insurance claims. Hospitals and clinics have entirely departments just to handle billing. It's estimated that about 25% of US healthcare spending goes to administrative costs. Compare that to countries with universal healthcare systems, where administrative costs are a fraction of what they are here. Now let's talk about the infamous medical bills. If you have spent any time online, you have probably seen stories of people getting hit with bills that seems more like punchlines than real numbers. For example, someone gets charged $1,005 for sitting in an ER waiting room without receiving treatment, or someone else gets $40 fee for holding their newborn baby after delivery. These stories hasn't outlined. They are part of a larger pattern where routine procedures and treatments come with jaw-dropping price tags. Take something as simple as an ambulance ride. In the US, that can cost anywhere from $500 to over $1,000 depending on where you live. That is just for the ride, not the treatment you might need when you arrive at the hospital. And what about something more serious, like cancer treatment? A single round of chemotherapy can cost tens of thousands of dollars, even with insurance. The out-of-pocket cost can be financially devastating. It's no wonder that medical debt is the leading cause of bankruptcy in the US. Let's move on to another huge problem: access. In theory, the US has some of the best doctors, hospitals, and medical technology in the world, but all of that means nothing if you can't afford to access it. Here is the thing: the US is one of the only developed countries where access to healthcare is tied to your employment. If you lose your job, you often lose your insurance. Even if you are employed, the insurance your company offers might not cover everything you need. And if you don't have insurance, good luck. You either face astronomical bills or being forced to avoid care altogether. This has real consequences. Studies have shown that uninsured Americans are far less likely to seek prospective care or visit a doctor when they are sick, which leads to worse health outcomes overall. Even for people with insurance, the system can be madly complicated. If you have got deductibles, co-pays in network and out-of-network providers, and surprise bills that come out of nowhere, it's a maze that leaves many people confused and frustrated. Now let's talk about inefficiency. Despite all the money the US spends on healthcare, the system often feels like it's running on outdated software. Patients face long wait times to see specialists, especially in rural areas where there might not be enough doctors. At the same time, doctors and nurses are stretching thin, overwhelmed with patients and mountains of paperwork. This not only affects the quality of care but also leads to burnout among healthcare workers. On top of that, the system is incredibly fragmented. Your primary care doctor might not communicate with your specialist, and your specialist might not know what your insurance covers. This lack of coordination leads to repeated tests, misdiagnoses, and a lot of wasted time and money. It's worth noting that many countries with universal healthcare system have streamlined processes that minimize this inefficiency. Yet, in the US, it often feels like you are navigating a labyrinth with your health and finances hanging in the balance. And here is the kicker: the US healthcare system isn't just broken, it's a profit driven. Hospitals, pharmaceutical companies, and insurance providers are all businesses. Their primary goal isn't to keep you healthy, it's to make money. Take prescription drugs for example. As Americans pay some of the highest prices in the world for medications. Insulin, a life-saving drug for diabetes, costs hundreds of dollars per month. In the US, while it's a fraction of that price in other countries, this isn't because the drugs are better here. It's because there is little regulation on drug prices, allowing companies to charge whatever they want. Insurance companies are another piece of the puzzle. Their goal is to minimize profits, which means denying claims whenever possible and making it as difficult as they can for you to get coverage. It's a system where profit comes before patients, and that is why so many people feel like the US healthcare system is less about care and more about cash. So, why do people say the US healthcare system is a joke? Because it's a system where an ambulance ride can cost more than a used car, where getting sick can ruin you financially, and where the quality of your health of care often depends on your ability to navigate a complicated and profit-driven system. It's a system where even people with insurance often feel like they are one medical emergency away from disaster, and it's a system where millions of people go without the care they need, not because the care isn't available, but because it's simply too expensive. Of course, the US healthcare system isn't all bad. We have incredible doctors, groundbreaking medical research, and cutting-edge technology. But these bright spots are overshadowed by a system that prioritizes profit over people. The question we have to ask ourselves is, can we do better? The answer is yes, but it will take political will, public pressure, and a fundamental shift in how we think about healthcare. Instead of treating it as a privilege, we need to recognize it as a human right. So, what do we think? Is the US healthcare system really a joke, or is it just misunderstood? Share your thoughts in the comments, and let's talk about how we can fix this broken system. Thank you for watching, and let's continue this conversation in the comments below. Let's share our thoughts and perspectives with one another. Don't forget to like, subscribe, and hit the notification bell to stay updated on this story and more.